Sound rolling.
Camera 1.
Rolling.
Camera 2. Rolling.
My name is Jane Bertrand. I'm a professor in the Tulane School of Public Health and Tropical Medicine. I also hold the Neal and Mary Vanselow Endowed Chair. In terms of my research focus, it has been for the last 50 years international family planning. I am one of the veterans here. I started here in 1979, and I have been here since then, except for 8 years in the 2000s when I was at Johns Hopkins. But the South and Tulane had a great allure, and as of 2009, I've been back here at Tulane at the School of Public Health. Do I have to admit that I married a Cajun? And as a result, it turned out it was the best possible decision. Tulane School of Public Health and Tropical Medicine has an outstanding reputation in the area of international health, which was what I knew I already wanted to do. So although it was somewhat personal happenstance that I ended up at Tulane, it could not have been a better fit for the kind of international work that I then wanted to go on and do. The work of the Stone Center has been very useful in having a solid base of scholarship, of students, of faculty interested in the area in Latin America. In my own case, I started my career in Latin America in the 1970s, in which I was working in Mexico, Guatemala, Colombia, El Salvador, and into the 80s, we had a very valuable link between the School of Public Health and the Stone Center. It was a joint program so that students who had interests in public health and Latin America really found a home here so that they could pursue both of their areas of interest. I've always appreciated knowing that the Stone Center was here, even if I was not a regular member in participating in all of its activities. I am one of the traders, according to Tom Reese, who moved from Latin America to sub-Saharan Africa in terms of their professional work. And this is in large part because Latin America has been phenomenally successful in family planning. They do not need los gringos to be coming down and giving technical assistance to make their family planning programs work. Something about so many Catholic countries, how can this be? But they are the continent that is a success story in family planning. As a result, those of us who work in this area, and I'm certainly not alone, have shifted much of our attention and focus to sub-Saharan Africa. Given that this has been the case, I was thrilled when the Agency for International Development asked me to lead up a team of 3 authors, along with Dr. Victoria Ward, the graduate from the Stone Center, and a colleague from Guatemala, Dr. Roberto Santiso, to write a report on family planning in Latin America and the Caribbean, the 50 years of accomplishments. And it was such a great opportunity to synthesize what have been the outstanding achievements in this area and to be able to revisit my roots in Latin America. That report came out in 2015, and so I feel I haven't totally abandoned Latin America. In terms of my own work in Guatemala, I started in 1976, and during the late 70s, one could travel all over the country. We'd get in the Jeep, we'd go from north to south, east to west, with absolutely no restrictions. Toward the 1980s, my counterpart there started to say, well, Jane, I think you should help us design the study and train the interviewers here in Guatemala City, but we don't want to have you out there. It's too much of a risk for you, and we don't want also to have the liability of your being out there. So the work changed in the way we performed the work had to change. which is not too different from other countries now where we work in public health, where you cannot just get in a Jeep and drive north to south, east to west safely. So that was probably my first taste of what the world of international public health was going to look like increasingly in the future. The one word that would describe the legacy of the Stone Center is commitment, and that would be commitment to advancing education, advancing scholarship, advancing practical programs such as the ones we do in public health on behalf of Tulane. Thank God you found that report. Thank you so much.